Hi, I'm Kimberly Brown, and today I'm going to go over GERD, gastroesophageal reflux disease. I will talk about the pathophysiology, diagnostic testing, clinical manifestation, interprofessional care, treatment plan, medication, and patient teaching. Okay, let's start with pathophysiology. GERD is the most common upper GI problems seen in adults. There are approximately 10 to 20% of the US population experiencing GERD symptoms at least once a week. GERD is the backflow of gastric and duodenum content into the esophagus. There is no single cause, but it's attributed to a conglomerate of reasons. The reflux is caused by incompetent lower esophageal sphincter, defective mucosal defense in the esophagus, impaired esophagus motility, delayed stomach emptying, and increased intra-abdominal pressure. Some diagnostic testing for GERD is simply doing a patient history and a physical exam. However, there's other more expensive exams just to make sure that you can be very thorough. You can do an upper GI endoscopy, which assesses the lower esophageal sphincter as far as how strong it is for competence. It can assess a degree of inflammation, scarring, and strictures. The upper GI endoscopy also is used to obtain a biopsy to do a testing to rule out cancer. There's also a barium swallow patients can do, and the barium swallow is used to detect protrusions of the gastric fundus. There's an esophageal motility study, and that's used to measure the pressure in the esophagus and the lower esophageal sphincter. There's ambulatory esophageal pH testing to test the pH content in the esophagus, and there's a radionuclide studies as well. Some clinical manifestations, signs, and symptoms of GERD are classified from mild to severe. Severe is when symptoms occur more than twice weekly. Another name for GERD is chronic heartburn, resulting from weakening of the lower esophageal sphincter. Heartburn is the feeling of burning under the lower sternum, which spreads to the throat or the jaw. Heartburn usually occurs after eating. Patients may have dyspepsia or regurgitation and pain in the upper abdomen. If regurgitation is involved, regurgitation is described as being hot, bitter, sour liquid. GERD patients some GERD patients also report having respiratory symptoms like wheezing and coughing and dyspnea. The medications involved with treating GERD is usually proton pump inhibitors, PPIs. PPIs and Prazole, Prazole. If you see a medication ended in those letters, it's a proton pump inhibitor. They are the most commonly used medications for GERD. Therefore, nurses should monitor the patients for adverse side effects of taking PPIs. Some adverse effects of PPIs include increased risk of fractures of the hip, the wrist, and the spine. Nurses should teach patients to use the lowest possible dose for the shortest amount of time because PPIs are also associated with C. diff for hospitalized patients. So if they have to go to the hospital, they might increase their risk of contracting C. diff. So some patient teaching interprofessional care will include lifestyle modifications. So you want to teach patients to avoid triggers, maintain their weight if they smoke, smoking cessation, stress management. So teaching patients how to identify their food triggers is very important. They could use an elimination diet, or something that can take food away from their diet and then put it back in so that they can observe if they're having triggers for a specific food. And if they determine that they have these triggers, then they can avoid those foods. You want to also teach patients about eating small meals and frequent meals. So instead of having 3 big meals, they'll have 6 smaller meals. They should avoid alcohol, smoking, caffeine beverages. Chocolate seems to be a trigger for a lot of people. Instruct patients not to lie down 2 to 3 hours after eating as well. And when they're wearing their garments, ensure that they don't have tight fitting clothing around their abdomen. So also after eating, patients need to bend down. That can be a trigger as well. So teach them not to bend down to pick anything up after they eat. Uh, Sometimes patients identify that they have respiratory symptoms with GERD as well. And for those respiratory symptoms, they're actually relieved by taking antacids. So, in conclusion, I talked about the pathophysiology of GERD along with diagnostic testing, clinical manifestations, which we talked about the burning pain in the upper GI area. We talked about the interprofessional care treatment focus, and that was including the patient teaching about food triggers, stress management, and weight management. We talked about the treatment plan and patient teaching, where we went into information about identifying food triggers and to eat smaller meals and don't have the 3 big meals, but you're going to have 6 smaller meals, not to bend down after eating. And then lastly, we went over the medications most commonly used in GERD are the proton pump inhibitors, PPIs, ending in the PRAZOLE. Thank you.